A number of people have requested some explanation on what dry needling is. So first I'll give the difference between dry needling and wet needling. It's very simple that with dry needling you insert a needle into the skin, and the needle is solid. It's a solid piece of metal, very sharp, and as you pop it in, that's all it is. The needle goes in and it sits there, and the needle does the work, or the position of the needle does the work. Wet needling is a needle that has a hollow core, and you insert it into the body and then you inject something through the needle. So that you can inject many different substances. I think the commonest is probably local anesthetic, but cortisone is used a lot, and then there are many other substances that are injected under the skin to have a therapeutic effect, and that's wet needling. So we come back to dry needling. The dry needling, there are different lengths of needles, and there are many different systems that are used for dry needling. One system uses very short needles which are inserted just through the skin. They sit in an area which is called the subcutaneous tissue. So this is just underneath the skin. Your skin is super sensitive. It has millions and millions of nerve endings which give you different bits of information, and they're very precise. So you have temperature sensors and pressure sensors and chemical sensors, and all of these are in rich abundance in your skin. And the reason that they're there is that your skin is designed to keep you safe, and so you need to know lots and lots of very important information. When something is pushing against you, which angle is it coming from? So you instinctively will pull back in the right direction, or is it too hot, or is it too cold, and so on. So what a dry needler does, who sticks these tiny little needles just under the skin, is they slip the tip of the needle into this richly innervated area, and by so doing they stimulate or irritate or interfere with a process that has been turned on, which is causing you pain or some other kind of symptomatology. So that's using short needles. Using longer needles, you use longer needles to end up in a area deep inside the body, and there are really two large or very commonly used systems. The first commonly used system is acupuncture, and this has been present for perhaps 2,000 years at least, and it's a system where a series of points have been designated in the body which are measured on your body quite precisely. You use something called a kun, which is the distance between two folds in your finger, so that the measurement is specific to your own body. And there are many points, and the points are all arranged along lines in your body, which are imaginary lines. They're called meridians, and there's this concept of energy flow in your body. So when you put a needle, and this is dry needling, so you just put an acupuncture needle into a particular point, what is meant to happen is that as the needle goes in, it strikes the acupuncture point. I, as a patient, as the needle goes in, I will feel a tiny little prick as it goes through my skin, or virtually nothing. If it's inserted properly, very fine needle, just tapped, so it goes zoom, straight through your skin. It will go down until it hits a point where you will feel something, and you'll feel it either as a tiny little, almost like a little electrical shock, the muscle may jump, or you may feel it like a deep ache, and then the needle is left, and it may then, depending on the practitioner and where it is, it may then be stimulated electrically, or it may be stimulated with your hand. There are many different types of stimulation. The way you put the needle in and take it out can be varied. In Korea, there's a whole sub class of acupuncture where different types of metal are used. So you have gold, or you have silver, or you have iron, and each one of these is supposed to have different qualities of action on your body. So all of these are sort of sub ways of looking at dry needling. There's another form of dry needling which is more and more commonly used in the West, and that is treating trigger points. So trigger points are hyper irritable areas in muscle where you have tiny little sensors, little nerves which are called spindles. They may become irritable, go into spasm, and with the needle what you do is you pop it through the skin and you go down and you search for the trigger point. As it hits the trigger point, you get exactly the same sensation. You get either a little electrical shock or a dull ache, or the muscle jumps, So what's actually happening here is that the majority of acupuncture points are also trigger points, and most dry needling is actually acting on trigger points in the body.